Well, infectious diseases physician Dr. Zain Chagla is back with us on Morning Live. We're talking shingles today because a new study shows a lot of people don't understand what shingles are unless you've had them.
Yeah, absolutely. And so important for people, particularly people over the age of 50, to remember that shingles is a vaccine preventable disease, but leads to complications that are really serious and can really be prevented with an effective vaccine.
And very, very painful. I had it. I got shingles when I was in my 30s, and I'm like the burning and the pain from that. Luckily, I had somebody that I was working with that knew what it was and said, get to a doctor right away. Because there is treatment, but you've got to get it within so many hours.
Yeah, absolutely. So, the shingles is the chickenpox virus, and essentially chickenpox lives in the nerves after we clear it as a child and comes out later in life. And you get the same rash as chickenpox, but the complication, as you mentioned, is that that nerve gets super irritated when the rash comes out. And that leads to that burning pain, which can be really, really profound for people. And even 5 to 15% of individuals may experience that pain even when the rash resolves. And recognizing that there are effective antivirals, there's effective vaccinations, there's a lot of good reasons to prevent getting shingles, and can be quite a bit of suffering for individuals who have some of the complications.
Is it shingles itself? Is it contagious?
So in certain individuals who are immunocompromised, who can't control the virus very well, they can spread it person to person through the air. The rash itself, if you touch it, is potentially contagious, but not as contagious as getting chickenpox as a child, which, people remember having pox parties, et cetera, where people all get it in the same room. It's not that contagious in that context.
Is there an age at which you have to be in order to get the vaccine?
So the vaccine is currently indicated in those over the age of 50, and that's where it's been studied the most. In people who are immune compromised as well, there is some really good evidence that the vaccine also benefits them. So really, anyone over the age of 18 who has risk factors should be considering the vaccine, and certainly anyone over the age of 50, even if they don't have risk factors, should be considering it.
And is there an increase in shingles right now?
So we are seeing a lot of cases. This is part of an aging population. So we're going to see, as age goes up, that shingles go up. We are seeing cases in younger individuals, and the entire reasoning isn't clear, but potentially, again, from stress and maybe not that exposure to chickenpox as a child. So definitely cases are on the rise, and I think we all have a story of someone who's experienced it. So again, more important for those over 50 to start considering it.
Okay, we've got a minute left. I want to ask you about what used to be a very common childhood illness, measles. Now it's not, and we're getting cases again. It can spread so rapidly.
Yeah, absolutely. So, very essential that people consider staying up to date with their vaccines. And the mechanism of cases that have come into Canada, including into the Hamilton and Brant area recently, have all been through international travel. So if you are traveling outside of Canada, worth it to talk to your primary care provider about measles vaccine. If you're born after 1970, it's 2 doses of a vaccine. And if you're born before 1970, it's 1 dose of a vaccine, or having had measles in the past.
And how long does it take that vaccine to take effect? If people went and got vaccinated now?
Sooner is better than later, but within 2 weeks, we see the benefits of the vaccine in terms of protecting people as they go traveling.
Because it can be a very serious illness.
Absolutely. We are seeing hospitalized cases, even in the ones that are showing up in Canada and the United States. And so, especially for patients who are at high risk, young children, et cetera, really need that immunity, especially if they're going to leave the country.
Okay. Dr. Zain Chagla, so nice to speak with you again.
All the best.